Hello, I am Leslie Apia, and I am the Division Chief of Academic Specialists in Obstetrics and Gynecology at the University of Colorado Anschutz Medical Campus. I also serve as the Medical Director of the Fertility Preservation and Reproductive Late Effects Program at the University of Colorado Comprehensive Cancer Center and Children's Hospital, Colorado. It is my pleasure to speak with you about best practices in pediatric, adolescent, and young adult oncofertility. There are estimated to be 2 million new cases of cancer in the United States in 2023. Of those, approximately 95,000 are expected to occur in the pediatric, adolescent, and young adult population. Due to early detection and newer targeted therapies, 5-year survival rates have significantly improved to 84% for this population, with an estimated 100,000 survivors of reproductive age annually. With survivors living longer, it is estimated that up to 3/4 will live to experience long-term adverse sequelae of cancer therapies termed late effects. The cancer care paradigm has thus shifted to include a focus of quality of life in survivorship, including screening for late effects, prevention of long-term sequelae, and implementation of evidence-based guidelines for symptom management. Reproductive late effects in survivorship are an often underdiagnosed and undertreated consequence of cancer therapy. These late effects include gonadal injury resulting in sub and infertility, genital graft versus host disease after stem cell transplant, radiation-induced uterine and vaginal injury, sexual dysfunction, and an increased risk of breast and cervical cancer after certain treatments. Alkylator and radiation therapies confer the highest risks of infertility. Therefore, risk stratification is based on these therapies using the cyclophosphamide equivalent dose and radiation risk stratification models. Standard and investigational fertility preservation options exist for male and female, pre- and post-pubertal patients, and young adults. Yet, less than 50% of patients recall receiving a fertility preservation consult, and less than 30% of those patients proceed with fertility preservation interventions. National and international guidelines exist to mitigate risk to fertility and improve reproductive health outcomes in survivorship. However, despite established guidelines, implementation is not standardized. Barriers include provider knowledge and bias, costs, and the lack of fertility preservation services at many academic and community medical centers. A standardized, comprehensive approach to fertility preservation and reproductive late effects care is necessary to address current low fertility preservation referral and uptake patterns to resolve inequities in care. This presentation on best practices in pediatric, adolescent, and young adult oncofertility seeks to present strategies to improve outcomes for this population with an equity lens. Thank you.